Hi, everyone. Can everybody hear me okay? I'll assume if I don't hear anything, then I'm going to just move along. Thank you so much, Zoometica, for sponsoring this talk. I have been practicing rehabilitation for over 15 years now, and what I really hope to get across to you guys today is using the latest knowledge we have on how to rehabilitate patients successfully to allow you to get better outcomes for your patients. As far as disclosures, I am a full-time veterinarian here at the Animal Medical Center. Zoometica is sponsoring today's lecture. I work on the advisory board for EliVet and as the consultant for the Honest Kitchen, neither of which should cause any bias in today's lecture. What we're going to be covering today, and please power through me with this. I promise you that it will be worthwhile in the end. But we are going to review a little bit about tissue healing. And the reason why we're going to do that is because it does impact how you come up with a rehab plan. And I'm going to hope to teach it to you in a way that is accessible to you, that makes sense, that you can apply with every patient. And it's going to help you choose how to progress a patient through their postoperative recovery or an injury. And then we're going to talk about some of the modalities, their mode of action, and their evidence on how that can also improve recovery for patients. I'll present the systematic review that I published on the evidence we have for recovery of specifically post-cruciate ligament patients. And then finally, I hope to spend the majority of the time on some specific rehab strategies, teaching you some exercises that you can introduce to your clinic and with your patients, and a nice case example. Okay, beginning with tissue healing. We know that all tissues follow the same general pattern of healing, and that is inflammation, proliferative or reparative phase, and remodeling maturation. So essentially, when an injury happens, first, there's bleeding, and that's essential because that brings healing cells to the area. And then almost immediately at the same time, we begin the inflammatory phase. A lot of us think of that as lasting like, maybe 24 to 48 hours, but it can certainly be longer. Sometimes it can be shorter. And then followed by that is the reparative or proliferative phases. Is a critical time in rehabilitation. And then finally, it's remodeling. I call it, if like you're building a new house, the reparative phase is where you're laying down the bricks. The remodeling is like when you get to decorate, right? It's the fine tuning. It's really getting things to look and function in the best way possible. Okay, so beginning with inflammation. Sorry, for some reason, some of my graphics have to click on it twice. So apologize for the clicking twice there. In the inflammatory phase, you can think of really, these key hallmarks of the inflammatory phase, which is that it's typically painful. It's going to be warm to the touch. It's going to look red, and you're going to have some swelling. So those are the 4 hallmarks of the inflammatory phase. And with that comes a loss of function. So the limb is no longer functioning in the way that it should because it's in the state of inflammation. Most of us, again, think about the inflammatory phase in the first 24 to 48 hours, but I encourage you to start thinking about it more as your assessment of the patient. Does it look red, swollen? Is it painful? Has it had loss of function? Because in some patients, they may exit that inflammatory phase sooner, and in others, they may linger in it as much as maybe 5 days. So it really is not on a timeline. It's more how that patient and the patient-specific circumstances that are going to affect it. This is a time where we have migration of a lot of cells into the area that help clean up the dead tissue and potentially if it's contaminated, and realize that the tissues are very weak. So it is important from a rehab perspective to immobilize the limb or the area that has been injured in order to allow for successful healing. Okay, this is a nice schematic of those various stages of tissue healing. So we talked about the bleeding. It almost begins simultaneously with the inflammatory phase, where we have a lot of redness, pain, swelling, but a lot of really good blood products that are coming in to help clean it up. And then perhaps the most important phase, which is the proliferative or reparative phase. This is where we have angiogenesis, so new blood vessels coming in, fibroplasia. There's a lot of increased collagen production. Collagen is important. Collagen is what's going to help build strength in those tissues. And it first begins with weaker type collagen 3 and then gets converted into the stronger type collagen 1, which is what most tissues should have. And one important thing to remember is that the fastest gain in strength for the tissues is going to be during that proliferative or reparative phase, which is 7 to 14 days. So this is why, if you think about in your postoperative patients, why we say rest for the first 2 weeks. And then that's also when we remove the sutures. This is why it has to do with tissue healing, because before then, our tissues are not going to be very strong, but in that first 2 weeks, you're going to gain a lot of strength, and it's from that collagen, switching from type 3 to type 1 collagen, which is a lot stronger. And then finally, that remodeling phase, where again, we do that fine tuning. Okay, so we're going to take a little tiny break here, and I'm going to quiz you guys. I think you have a chat function, so I want you to answer in your chat, and then hopefully Susan can tell us your responses. But I'm going to play this video, and you tell me, what stage of tissue healing is this dog in? What does it look like? Is it red? I think yes. Is it swollen? Very swollen. Is the dog painful? Probably. He's not putting that foot down. So then you know there's no function of the limb either, right? So, okay, I think I see some Q&A answers in here. Maybe Susan can tell us some of the answers that were given here.
So we have inflammation, and chat is disabled, everyone. I apologize. So yes, type your answers in the Q&A box.
Q&A box, sorry.
So inflammation came through. Somebody came through with stage 1.
Yep, stage 1 of tissue healing. Awesome, guys. So this was easy. But yeah, of course, this dog is in an inflammatory stage of healing. And you're going to know when he exits that stage of tissue healing, when the redness goes away, the inflammation goes down, and he starts to use that leg. And that's when you're entering that reparative phase. Typically, again, in that 7 to 14 days is where you're going to gain your greatest strength. Okay. Good. So what does this mean as far as what we can do from rehab strategies for improving their recovery? Well, what we do typically here at the Animal Medical Center for patients that are coming straight out of the OR, our team is coming in and working with them. We're going to do compressive cryotherapy. So that's this machine that you see over there. I think you guys can see my cursor. And what it does is it's a wrap over the knee. So this is a post-op TPO low. And then in addition to it pumping very cold water, it's also compressing the limb to help reduce that inflammation. Ideally, if you can do those two simultaneously, it's better than just ice alone. And then underneath that, you'll see we have this TENS machine. So that provides transcutaneous electrical nerve stimulation that helps reduce pain. Remember, pain is an important component of inflammation. We also have an Assisi loop. This was actually the old model, but this is pulsed electromagnetic field therapy. It's FDA approved for reducing soft tissue pain, swelling and inflammation anywhere in the body, and it will penetrate through bandages. So it's a wonderful thing that you can do even as you're doing your cold compression therapy. Photobiomodulation might be particularly useful for the wound, especially to improve healing. And what about shockwave? I don't think a lot of us are using shockwave in that immediate inflammatory phase of healing in our patients. But guess what? We actually have these 4 papers that give us some really good evidence that shockwave actually can improve patients when they're in that inflammatory phase. So those first 3 papers all demonstrated, they were all prospective studies, randomized controlled clinical trials. Well, one of the Barnes ones was non-randomized, but they were all prospective clinical trials. And they basically all demonstrated superior osteotomy healing by using extracorporeal shockwave therapy in these TPO low patients. So again, surgery was just finished. They are in the inflammatory phase, and right away we hit them with that shockwave and we jumpstart the healing of that osteotomy site. And then the final paper there, the Gallagher, that looked at patients that received extracorporeal shockwave therapy to the patellar ligament, helping to reduce patellar desmitis that we know is one of the biggest complications with TPLO. So maybe you're not using shockwave right now in your inflammatory phase of tissue healing, but we certainly have a lot of evidence that it can help. Okay, moving along into that reparative phase. Remember, this is where we have the angiogenesis, fibroplasia, increased collagen production. And initially, those tissues are very weak. because we have the type 3 collagen, which is what you have with granulation tissue. And then that gets replaced to type 1 collagen. And that's from the fibroblast together with the extracellular matrix that is making that conversion. So you're going to have a rapid gain of strength from this conversion of collagen in the first week to 2 weeks. However, reparative phase is expected to last much longer, and that phase depends on your tissue. So for example, if we're talking about muscle, that's going to take 4 to 6 weeks. If we're talking about skin, usually by 14 days, we might be finished. So it depends on the tissue that you're actually targeting in the healing. But suffice to say that we want to make sure that the healing in this stage is protected. So this means that we're allowing the dog to start moving. We're doing some rehab interventions, but we want to make sure that we are moving the tissue not outside of its range of motion so that we don't create an extra what we call gap formation, which means that the tissue will be weaker and we tend to have more scar tissue than we do replacement of the primary tissue. Let's say it's muscle, for example. You tear a muscle and we're in that reparative phase. If we're stretching that muscle too much, then we lose the integrity of those myocytes building across the area that's been damaged, and instead we have a little gap. And when we have the gap, we lay down fibrous tissue instead of the myofibers. So just keep that in mind, that while we do want to be doing rehab strategies, we want to make sure that we move the limb or the area that's injured within the functional parameters and not beyond that. Now, moving into the remodeling phase, now here is when we actually want to get pretty aggressive about building strength of those muscles, and it needs to be according to the lines of stress. You may have heard about Wolff's Law. This pertains to bone. So if you have an osteotomy or you actually have a fracture, and that bone is trying to heal, you're going to gain the greatest strength by actually loading the bone. So in other words, if you let that dog sit in a cage and say, oh, it's got a fracture, we have to let it rest. Well, that's great for the inflammatory phase, to some degree the reparative phase. But if you really want to gain strength of that bone, that patient needs to be weight bearing through the appropriate lines of stress. And that is what stimulates the osteoblast to set down and build that callus. So key here for remodeling is optimal loading. Optimal loading is what you want to remember here. And the other thing to remember is that for all tissue types, none of them will regain 100% of strength except bone. Bone will regain 100% of its strength, but skin, muscle, tendon, joint capsule, fascia, none of them will regain 100% strength. That's why rehab is so important. This is a nice chart that you can even print and laminate. That's what we do here. This came out of the Vet Search publication in 2020. I was a co-author there with my colleague who I adore, Kristen Kirkby-Shaw. This is an open access paper. The paper is the Fundamental Principles of Rehabilitation. And this is a chart that gives you a timeline of what we expect the tissue healing to be for each of the different types of tissue. So again, for skin, in that first few days to 14 days, you're going to regain the majority of your strength and recovery, but it can take up to a full 12 months even if there's scar formation in there. And then when you're talking about fascia, which is really what you compromise in a TPLO, remember you raise that pes anserinus in order to access the tibia. That fascia is going to take anywhere from 3 weeks to 7 weeks to heal. So you have to keep that in mind when you're rehabbing the patient. When we're talking about muscle, depending on the degree of injury, it could range from just a few weeks to up to 6 months, and so on for the various different tissues. So it's important to know what tissue has been compromised in order to know how to progress through rehab. Okay, moving on to our modalities and what we can use in order to speed up that recovery. There we go. All right, so in the inflammatory phase, what I would recommend that you implement in your clinic is by far the greatest evidence is for cryotherapy. So you need to ice the area that has been injured or that has been incised through surgery. And ideally, again, if that can be compressive cryotherapy, that's even better. And then I would say really good modalities that can also help to speed up the recovery during the inflammatory phase is pulsed electromagnetic field therapy and also photobiomodulation. So that's laser. And don't forget, again, we have that evidence for shockwave in particular if you have a fracture or an osteotomy site that's been inflicted, that has occurred through surgery. For the reparative phase, remember this is where tissues are weak, but then have a rapid gain of strength in that first 2 weeks. Pulsed electromagnetic field therapy can be very useful, extracorporeal shockwave therapy, and definitely photobiomodulation as well. And then I would say remodeling, this is when we're really wanting to put those tissues through the optimal loading. That's when shockwave I find to be really useful because now you're in a chronic phase of healing and you're really trying to get fibers to align appropriately to gain maximal strength. And whenever you're dealing with something more chronic, I find extracorporeal shockwave to be particularly useful. Let me make sure. Yeah. So on extracorporeal shockwave therapy, for any of you who are not familiar with it, these are high pressure, high velocity, but low frequency sound waves that are going to penetrate the tissue. And inside that tissue, what happens is we get cavitation. So basically first a bubble forms and then the bubble collapses. And when that happens, we get a massive infiltration of blood flow to the area, a high release of endorphins, and in general sets up a healing mechanism within the body. So it sort of stirs up. Some people say it's like you go back to the inflammatory phase, but actually all the mediators are anti-inflammatory. So what's similar about it is you're going to bring a lot of blood flow to the area, but actually you get anti-inflammatory cytokines released during shockwave. So it's a sound wave energy, very high energy, high velocity, low frequency, which means there's no heat generated. So unlike laser therapy, you cannot burn a patient with shockwave therapy. And that's going to bring you a lot of immediate speeding of your recovery of those tissues. Now, there are a lot of different shockwave machines out there, and they are not all equal. There are piezoelectric machines, there are radial shockwave machines. The only machine that has evidence in the veterinary industry is the electrohydraulic shockwave. And what I'm picturing here, which is the PulseVet machine, this is electrohydraulic shockwave. And we have many studies demonstrating efficacy in dogs. We already talked about 4 that looked at patients recovering from TPLO, 3 of which that showed improved osteotomy healing, 1 that improved patellar desmitis. And then we have a couple of studies demonstrating improvement for osteoarthritis. So if the injury is in the joint, and you're dealing with a more chronic phase like remodeling type of healing, then extracorporeal shockwave therapy has been shown to be effective for OA, both in the stifle and the elbow. Realize also that while the initial machine required sedation in order to treat patients, the new extrode for this machine does not require any sedation at all. And I'm going to show you a case example where you can see the dog is fully awake and tolerating the therapy without a problem. The other really nice modality is pulsed electromagnetic field therapy. This is targeted pulsed electromagnetic field therapy. We also call it focused. And this is an FDA-approved device that emits a very low frequency signal specific to the FDA in order for it to be in the biological levels. So it is quite safe. I don't worry about any type of contraindications except if the patient has a pacemaker. And if it does have a pacemaker, you just don't want to put this over their heart. But even at a distant location, it would be okay. And other than that, perhaps you don't want to put it over a primary tumor, although we do have some anecdotal evidence that even over a primary tumor, it can help to reduce inflammation. What's really nice about the PMF is it will penetrate through bandages, so that the field of emission is approximately 20 centimeters that goes both above and below this little ring here. And you can just lay it over the patient to treat a large area. Also for small dogs or cats, you can actually loop it through their belly and it can treat their entire spine. So really, really nice for your hemilaminectomies, for example. And we have two really nice papers, one of which I published. That was published in JAHA 2019, where I looked at post-op hemilaminectomy patients, and we found that dogs with the PMF therapy required less postoperative pain relievers at home than the patients that had the sham treatment. And cats love PMF therapy. I also love it for exotic patients because they don't feel anything. It's very non-invasive. You just press the power button, it turns on, and it emits the therapy. So again, PMF can be really, really useful in the inflammatory phase, the reparative phase. I don't think of it quite as much in the remodeling, but for chronic conditions that you just need pain relief for, definitely PMF can be useful as well. And then I just wanted to speak briefly about the paper that I published last year. This was a systematic review on the post-operative rehabilitation interventions in dogs recovering from cruciate ligament disease. This is an open access paper, so for any of you that are interested in, you can just type in my name and then systematic review post-operative rehabilitation, and it should come up. Just to remind you on levels of evidence, when somebody's speaking to you like I am, that would be considered expert opinion, right? So that's at the bottom of the pyramid here. And there's people we highly respect and we really trust the information they're giving us, but just know that it's considered the lowest level of evidence. After that comes when we have a case report series that is published, then a case control study, a cohort study, randomized controlled clinical trials. That's most of what we have and what we consider high level of evidence in veterinary medicine is when we have randomized controlled clinical trials. But even higher than that is a systematic review. A systematic review is going to take into account all of the current published evidence to date and look at it together in order to come up with a conclusion or consensus statement about what is best for treating that condition. And then if you can put that data through statistical analysis, that's now called a meta-analysis. So the highest level of evidence are systematic reviews and meta-analyses. And that is exactly what I did in the study looking at the rehab interventions and what helps dogs recovering from post-op rehab, from post-op TPOs, what is the most effective therapies for those patients. In my study, I searched, the search criteria matched 351 papers. 19 of those actually met the inclusion criteria. And so the study included 19 randomized controlled clinical trials. We found positive results in rehab interventions for 16 of those studies. So that's really nice to know. We have a very high level of evidence demonstrating that rehab interventions do help dogs recovering from postoperative cruciate ligament surgery. They do have improvement with the rehab interventions. Majority of those papers were a level 2 evidence. So that's higher in the pyramid, 12 of those papers, with 6 papers at class 3 level of evidence and 1 at class 4 level of evidence. The largest number of supportive studies, interestingly, were on therapeutic exercise. So it actually was not in the modalities. I think all of us want to, wave a laser on our patients and know that they're going to get better. But it's actually, if you think about if you've ever had an injury, it's the physical therapist working with you. And it's what you do physically with your body that helps you improve. And that is exactly what we found in this study. But then after that, we did find that cold compression therapy was the next highest level of evidence for improving recovery for these post-op cruciate patients. And then next after that was extracorporeal shockwave therapy, also with 3 supporting studies. And then after that, it really fell out. Even though photobiomodulation had 2 supportive studies, one of them notably had negative results. So they actually did worse when they received laser therapy. So in conclusion from the systematic review, we were recommending therapeutic exercise and cold compression therapy as the primary 2 modalities to use in improving recovery, followed by extracorporeal shockwave therapy. The other modalities, which included low-level ultrasound therapy and neuromuscular electrical stimulation, did not have good evidence behind them, and photobiomodulation had those mixed reviews. Okay, moving on to our rehab strategies, because this is what I want us to spend most of our time today, is teaching you some nice exercises and when to intervene according to these tissue healing principles. So in your immediate post-injury or post-operative phases, remember that we're going to be dealing with inflammation. And so really the goal here is to reduce pain, swelling, inflammation, and to start to get a little bit of function back from these tissues. So for a post-op, let's say, cruciate patient or any kind of knee surgery, what I typically recommend starting with is weight shifting exercises. So first, you're going to put your patient on a traction flooring surface. And if, let's say, the dog had a right TPLO, I'm going to gently sway the dog from its left hip towards the right to improve weight bearing towards the right side. So I'll just play that for you again. Make sure the legs are squarely placed, meaning that the back leg is directly behind the front legs. And then we're going to give a gentle push from left to right. If the dog is recovering from a right knee surgery, it would be opposite if it was on the left side. We also want to do things like passive range of motion and massage, again, to try to decrease that swelling and inflammation. So here's an explanation of me doing a hip extension, and I'm doing massage along the iliopsoas, so those hip flexors. Typically in a dog recovering from knee surgery, they're going to have very, very taut hip flexors. So I'm going to massage that area as I'm gently bringing that hip into extension, and then I'm doing a little bit of range of motion. The other part that's really useful is don't just treat the part of the body that had the primary injury. The body works as a whole, and there's usually compensatory problems. So I'm giving a nice massage to the triceps muscles and then along the epaxials, which is all very beneficial to getting that patient to recovery. I'll play that one for you again. So I'm doing massage of the hip flexors as I'm simultaneously gently extending the hip. Remember that in this inflammatory early reparative phase, you don't want to go to end range of motion. So you'll see I'm not like being very aggressive about the movement of the leg. It's a very gentle, guided movement. In fact, I like to keep my hands open when I do that range of motion. And make sure the limb is aligned along the body, parallel, not abducted, which I often see. Massage of the triceps is a common area where dogs develop a lot of compensatory issues, and then along the epaxials, particularly in the lumbar spine for a hind limb surgery or injury. Okay, cool. Moving on then for our reparative phase. So remember, we're going to gain rapid strength in the first week to 2 weeks, but it can often last longer, typically into 4 to 6 weeks. And this is where we want to start to begin to improve the function of our limbs, but we don't want to be too aggressive because we don't want to create those gaps where we can get fibrous tissue laying down instead of the primary tissue. So we want to do that optimal loading that we talked about. We want to always have that traction flooring, and we want to begin with some exercises, but not being too aggressive. So a nice one for a hind limb would be sit to stand exercises. They're very functional. So this dog is going into a straight sit, and then we're having them rise from that. So in the reparative phase, I typically recommend starting with about 2 to 5 sit to stands consecutively in the first 2 to 4 weeks, and then you can increase those reps as they improve. In one of the papers, the Balter actually published a paper in this. She started with 10 sit to stands right at 2 weeks post-op. I think that's a little bit aggressive, particularly with an osteotomy site, but certainly I think 3 sit to stands is appropriate 2 weeks post-op, and then as that patient is fully weight bearing and improving, you can move your way up to 5 and then maybe 10, but I would be really wanting to be exiting that reparative phase and more into like the 4 to 6 week mark before I get that aggressive. And then a 3-leg stand exercise can be really nice. This is an isometric exercise. So you're not mobilizing the joint, but you're lifting one of the limbs. So they have to weight bear through the 3 remaining limbs. It's excellent for gaining strength in all the legs that are still on the ground, but also excellent for improving core strength, which is always good in postoperative recovery. And that one, I would begin with 3 repetitions. And for all of these, you can do these twice a day. I always give 1 day break per week where you're not doing any of the exercises. So again, in your inflammatory phase, I would begin with some weight shifting exercises, very gentle passive range of motion, not to end range, lots of massage to those top muscles to help reduce swelling and edema. Once you're in your reparative phase, you can begin some nice functional exercises like sit to stands. Begin maybe with 3, moving your way up to 5, but wait on being more aggressive until 4 to 6 week mark. And then a 3-leg stand or another isometric exercise like an elevated stand with 3 repetitions twice daily. Okay, and then finally in your remodeling phase, remember, this is where we're going to gain that final level of strength. So this is where you can really get more aggressive about increasing repetitions, increasing hold times, and what we call eccentric contractions. So when a muscle contracts, it can shorten or it can lengthen during contraction. A good example of that is your biceps muscle. So if you bend your elbow, you'll feel your biceps is getting strong and the muscle is shortening in contraction. But if I then extend my elbow slowly, if you feel your biceps, it's still working, it's contracting, but the fibers are lengthening during contraction. It turns out that eccentric contractions are the best way for us to gain strength in a muscle. And so it is the final stage of rehabilitation is introducing eccentric exercise. And I'll give you some ideas of what those can be. But here the remodeling, typically starting around 4 to 6 weeks, but it can go on then into years depending on the type of tissue that you're talking about. And this is again where you can really want to line up tissues according to lines of stress and get more aggressive about your hold times and repetitions. Chronic injuries are always in that remodeling phase, except sometimes there can be an acute on chronic phase where there's a flare. It's already in a chronic stage of healing, but you can acutely injure those tissues, and that involves a little bit of inflammation. So just to add a little bit of complexity to that, just because you have an old injury doesn't mean you can't go back to an inflammatory phase. And a classic example of that is a dog with arthritis, right? The original joint injury may have been when they were 1 year of age. Now they have OA, right? They're in a chronic state of healing, but then they can overdo it and they can have an acute exacerbation. You're back into the inflammatory phase, okay? All right, let's think about how to apply this to a case. So this was a really lovely dog, a 9.5-year-old male neutered rough collie that presented to me really as a last resort. If there's anything you can do to help my dog. The owner was actually a veterinarian. Dog had mediastinal large cell lymphoma and was progressively getting really weak in his hind legs. She said that he really was unable to walk up the stairs anymore. He was having a lot of difficulty rising from a down position, and he'd also was less social. He wasn't cuddling as much as he was. So we actually admitted him to the hospital for a continuous rate infusion of fentanyl ketamine CRI. So you can see him here. He's hospitalized. You can see how crouched his hind limb gait is. He's extremely weak. He also just looks painful. You see that tail is not up. He can't really fully extend his knees because he's experiencing severe pain in his LS region. So after we hospitalized him, we gave him his continuous rate infusion. He also received extracorporeal shockwave therapy. I don't know if you guys can hear the shockwave, but you can see he's fully awake. He tolerates this no problem. We just put gel on there. That's mom with him holding him. It's perfectly calm. It can be a little loud, but most dogs will tolerate it fine, again, with no sedation whatsoever. And what we did then for him, in addition to the fentanyl lidocaine ketamine CRI, we also did extracorporeal shockwave therapy for him. He also received acupuncture, and he did also enroll in formal rehabilitation. And at home, mom took the Assisi loop, that PMF therapy, and she put it over that lower back area to give him comfort. And we had really, really good success with him. Mom was just hoping for like a few more days or weeks, but he actually lived for a couple more months, despite his metastatic lymphoma. Look at how nicely his tail is up now. He's walking, he's not crouched. He's feeling good. He was able to climb the stairs again. He started to play with mom again and cuddle. So really, really great return of quality of life for this patient. And look how easily he was able to sit and stand, which he was basically unable to do before the therapy. And what's nice also about the shockwave therapy is after we did a round of it, we were able to repeat a round of it to get him comfort there again without having to do the epidural.